Hello, hi everyone. I'm Gautam. I'm a cardiac surgeon. Today I want to talk about how the heart attack actually happens, what we call myocardial infarction. I'm a cardiac surgeon and we perform routine cardiac bypasses on a daily basis on these patients who have a history of heart attack. Now, I must tell you what a heart attack or a myocardial infarction actually is. Now, before we understand what a heart attack or a myocardial infarction is, I think that most of us will know that there is blood vessels on the surface of the heart, and if those blood vessels gets clogged and clotted, there is no blood supply to the heart muscle, and it dies, and that causes a heart attack. Now, before we enter that, we have to know that the heart has got blood supply from two primary systems. One is supplying the left side predominantly and the middle part of the heart, and one that is supplying the right side. So that is supplying the left side of the heart, we call it as the left coronary system. Then that is supplying the right side of the heart is called the right coronary system. Further getting into the nuances, you can check it if you want. We call it as a left main artery, which then courses as a left circumflex artery, left anterior descending artery. These are the two branches that supply the front and the left side of the heart. And there is one thing called the right coronary artery that supplies the right side of the heart. Now, in my previous video, I did discuss that what causes these heart attacks. I told you about the number one cause being smoking, alcoholism, diabetes, obesity, advancing age, and genetic factors. I also told you about non-alcoholic steatohepatitis and NFLD and stress as factors, causing heart attacks in young. Now, what actually happens inside the blood vessel is there is something called buildup of a fatty streak. Now, all these factors, that is smoking, alcoholism, stress, and all these factors which I just mentioned, what they do is there is a gradual build-up of atherosclerotic burden, or we call it as a fatty streak, or that actually blocks the coronary artery. If this is the vessel and actual lumen of the vessel, there is a gradual narrowing of this vessel that happens from the start of the disease process. Now, it starts at the late 20s, early 30s, and progresses till 60s. So, well until 80 to 90% of the artery is blocked, we don't find the disease to actually manifest as a heart attack. Now, what happens is because all these factors like smoking, alcoholism, stress, advancing age, genetic factors, pollution, and all these factors, what happens is there is a gradual buildup of fatty streak inside the artery. Now, the artery has got three structures. It's called intima, media, and adventitia. Now, this streak starts building in the medial layer of the artery. So, there is gradual buildup of plaque inside the artery, which gradually extends, and narrows down the artery. Now, this process of deposition of cholesterol and fatty streaks and lipid peroxidation products, all this in the medial layer of the coronary artery that I was talking, that causes carries blood to the heart. There is a gradual narrowing of this lumen of the artery. Now, what happens by time there is gradual increase in this fatty streak, that gradually decreases the lumen up to 80 to 90% of the artery. Then imagine the amount of blood supply that is traveling to the heart is traveling only via the 10% of the patent artery. 10% of the patent vessel is only supplying the whole of the heart. Now, what happens at age 50, 55, 60, 65, because of this gradual accumulation of fatty layer and plaque that approaches the muscle wall and the intima, the innermost layer of the blood vessel. Now, just imagine if that part of the vessel immediately breaks off, that nips. So, this fatty streak goes ahead in the arteries and it causes total occlusion of this artery. That causes acute loss in blood supply to that part of the heart. Now this in medical terms is called necrosis, or what we call in normal term is there is death of that part of the heart that is receiving blood supply from that artery. So this is what we call it as an infarct. And if it happens in the myocardium is that heart muscle in the heart, the middle layer of the heart is called myocardium and the muscle. And now if that part of the muscle does not receive blood supply because of this rupture of this plaque that goes and lodges distally in the artery, that causes immediate shut or immediate closure of the gates of blood supply that reaches this muscle. So this is called as a myocardial infarction, or in layman terms we call it as a heart attack. So what I want to tell you is this heart attack or myocardial infarction is not an event that is sudden as we think. It is a disease process that has evolved over multiple years, over 30, 35, 40 years. And the event is that plaque that has accumulated over 30, 40 years in the medial wall. Now that ruptures and lodges distally in the arteries like a road, causes complete blockage of that road. This is how exactly the heart attack takes place. So as I told you, this gets lodged in the left coronary system. We have two arteries. The major artery is the left circumflex artery or the left anterior descending artery in the front of the heart. This can also happen on the right side of the heart. It's called right coronary system. Now they are called multiple branches of it, which I will discuss in later in this video series of later started. So this is the basic understanding of how a heart attack occurs. I mean, this was my way of explaining. If you had liked it, please click the like button, and if you would like further medical content, please subscribe. Thank you.